All right, here's my audience. Here's my note cards. All right. Imagine reliving your worst nightmare day after day. No matter what you do, you cannot wake up from it. That's what people with post-traumatic stress disorder experience. PTSD does not affect one group of people. Men, women, and children of all ethnic groups can be affected by this disorder. PTSD has multiple causes, signs, and symptoms, and is a disorder that can be managed. Today I'm going to talk to you about the causes, diagnosis, and treatment of PTSD. PTSD is an emotional and behavioral disturbance that may occur after an exposure to an exceptionally stressful event. About 1 in every 30 adults will suffer from PTSD. The causes are not limited to physical events. Some events that can cause PTSD include sexual assault, physical and emotional abuse, car accidents, combat and war, and witnessing violent deaths. PTSD can be diagnosed by a healthcare provider doing interviews with the patient and discussing their signs and symptoms over a 4-week time span. Some of the symptoms include difficulty sleeping, difficulty remembering important parts of traumatic events, nightmares, replaying of stressful situations, angry outbursts, and irritability. These symptoms can occur across a range of intensities that vary from person to person. Reactions can be low intensity, which is the mildest pattern that can be resolved on its own by using different coping mechanisms by the patient. Then you have moderate intensity, which usually requires professional assistance but can be managed without many interventions. And then you have severe intensity, which requires professional help, intense counseling, and medication. It is important to not self-diagnose and treat, and to seek professional help if the symptoms are present. There's more than one treatment option for people diagnosed with PTSD. Cognitive therapy, thought to be the most effective treatment, is a formal conversation with a therapist to better understand the meaning behind the trauma. Exposure therapy, which involves changing how a person reacts to their stressful memory. This is done by repeated discussions about the trauma. It can help control the thoughts and feelings associated with that trauma. Final option for treatment is a combination of counseling and medication. Medication is often used when people are overwhelmed with their symptoms of distress or have several simultaneous psychological conditions. Today I told you about the many different causes of PTSD, the diagnosis process, as well as the treatment options. PTSD is a disorder that should not be ignored. Nobody should have to live a life hindered by the symptoms. Having PTSD is not shameful. Bad memories may last a lifetime, but PTSD is not a life sentence. All right. This is my audience again.